This is been on the mucosal layer of the rectum. Protrudes. Comes out proteins. Yeah.
Protrudes out
of the anus.
Okay, so this one is minor. So, and then how we can treat this? So because treatment, because it involves only the
Mucosal
layer of the rectum. The treatment can
can be done by using
using drug therapy.
Drug therapy?
Without surgery.
So if only mucus come out of the rectum to the anus by drug.
Treatments of hemorrhoids. Is enough to resolve this condition. Okay, then if you want to do if it is for major rectal.
Master, do you know which drug we should give to that patient?
Yes, now any drug that will reduce
mucosa.
That will reduce you know, this mucosa does not extend by itself. It is because enlargement of the blood vessels that are there. It is because of the enlargement of the blood vessels. That's why if you see it will be red. You can check it in YouTube, your phone. It will be red. It is because of the distension of the veins, rectal veins. So what you're going to do, you're going to change first primarily the diet of this person. It should not eat oily food, it should not eat sugary food, it should not eat fast food. The person should eat a lot of vegetables. It is the best. So the person should eat a lot of vegetables, especially the ones that are not very sweet. So it is the main therapy and diet. So it is the main method. Then another thing that you can also do is so you can take anti-cholesterol drugs. And then you can take you can control the sugar level in the body of this person, in the blood of the person. You understand? Drugs that we use, like drugs that are going to stimulate production of insulin. So insulin can reduce the circulatory sugar level of the person.
To go down.
So these are the main treatment. Okay, then for the major prolapse, this condition involves complete protrusion.
All there, mucosa, submucosa, serosa.
Complete protrusion of the
rectum.
Of the rectal walls. You understand?
Yeah.
And so, therefore, only surgical treatment is effective. You understand?
Understand?
So now, but this is just like 75% of your answer. With this, you understand, you've answered, you've told them different. They will ask, even if you don't say, they will ask, what do you know about where do we have this prolapse? How does it happen? What makes it happen? Then the other thing that you also should remember is the part of the rectum. How many parts of the rectum do you remember? So then you're going to talk about the superior, middle, and inferior.
Inferior, yeah.
So they will ask, what can't cause rectal prolapse? Then you can talk about portal hypertension.
Portal hypertension.
Abnormal diet. Liver disease.
Portal hypertension, it is what, Mansour?
What?
It's portal hypertension, it means that portal vein.
Yeah, it's just when there is increased pressure in portal veins.
Portal vein, yeah.
So abnormal diet and so
Liver disease.
and then as you
Mansour, can I ask a question? Portal hypertension, how it caused how it's caused, for example, the mucosa and
it is your question is like this. If maybe your teacher may want to ask you, then it will not be how does it will say pathogenesis of rectal prolapse. So now you want to answer based on liver disease or portal hypertension.
portal hypertension.
So see, between the liver and the intestines, there is a specific type of circulatory system where blood pass from the intestine to the liver and from the liver into the inferior vena cava. When there is problem with the liver will either become smaller. If it becomes smaller, usually in the case of cirrhosis, or it becomes enlarged in some cases of hepatitis. So now, if the liver, especially in the case of cirrhosis, becomes small, it will not allow easy passage of blood that is coming from the intestine to this inferior vena cava. Then a lot of this blood that should be going to the inferior vena cava will not be able to go, but they will remain in the
liver.
They will remain not in the liver because liver is shrink already. It cannot allow too much blood to come. So this blood will remain in the intestine. So from small intestine it will go to the large intestine. From large intestine it will go to the rectum.
The rectum.
But why did it go? Where does this blood go to? It will go to one rectal vein. When it goes to rectal vein, it causes what we refer to as hemorrhoids. You understand?
Hemorrhoid.
If it goes to the anterior abdominal walls vessels, it causes
So I mean that phase, Mansour,
yeah, something medusae. It causes what they call it head of Medusa. head of medusa, and then it can also go to the, you understand that it is problem now, this blood is not going to the inferior vena cava, but it should go to the inferior vena cava, from inferior vena cava to the heart, but it's not going. So because of this now, this blood will now go back to where it is coming from.
Yeah.
It will go back to the stomach and then to esophagus. So it will also go back to the esophagus,
Esophageal varices, yeah?
So it's now going to cause esophageal varices. Yes.
Esophageal varices.
So you can see it is like that. This is your question is, how does it cause this? You understand?
Yeah.
So it is because
But Mansour, this anterior abdominal wall, you mean only how it's not organ, yeah?
Yeah, because why it is like that is because some there in these places there are what will cause portocarpal anastomosis.
Portocarpal anastomosis.
So it is like this. It is like this because of in these places there are anastomosis that happens. So because of this anastomosis,
And they are connected to each other, you mean, yeah?
Yeah, because of this anastomosis that happens between them, if there is problem and then blood cannot come from the portal system into the cava system, then there's going to be accumulation of blood in the portal system. So then you are going to have portal hypertension. From portal hypertension, you are going to have hemorrhoid because of accumulation of blood in the rectal veins. You are going to have head of medusae, caput medusae, because of the accumulation of blood in the anterior abdominal wall vessels. You are going to have esophageal varices because of accumulation of blood in the esophageal vessels. And at the end of the day, you are going to have what they refer to as what they call that one, it is when there is now going to be intoxication, general intoxication, and this one is going to lead to what encephalopathy. They call it encephalopathy. Yeah, it's going to. So in this case, it is when there is this intoxication in the blood that is affecting the brain. So that's what they call encephalopathy. So this is the pathogenesis of how that one will cause that one, according to your
Mansour, just by drawing, can you just draw the venous, how it go from portal vein to the small intestine, large intestine to the rectum? Just photo, Mansour, it will be good.
I don't understand your question.
I mean by draw. For example, draw the portal vein, how it connect to large intestine, small intestine, then to the rectum. Mansour, then I will not be filled by.
You don't understand it. It is like this. We have we have abdominal aorta.
Aorta, yeah.
Then it comes to abdominal aorta.
Abdominal aorta.
Abdominal aorta will give two branches to the abdomen, and it will go down, and it's now going to give two terminal branches that are going to be iliac artery, left and right iliac artery. Left and right iliac artery will divide into two. So this one that is here is going to give some branches to the stomach, that will supply the stomach. It's going to
I go.